Very excited to welcome back to the Damage Report Professor and Director of the Center for Medicine, Health, and Society at Vanderbilt University, as well as the author of Dying of Whiteness, Jonathan Metzl. Welcome back to the Damage Report.
Thanks so much, great to be back.
It's great to have you here, and you're very well suited to talk about the spate of breaking news that we've had over the past week or so. So you teach a course at Vanderbilt about COVID and society. Now that obviously touches on a lot of different things, but now when you have not only the president and the first lady, but so many people in the White House becoming infected with coronavirus in a short period of time, tell me a little bit about this, about how you react to the news and how you think America will react to this huge turn of events right before an election.
Well, it's momentous. I mean, I'm glad you mentioned our class. We're teaching a class, a couple of colleagues and mine and myself, called COVID and Society, and we're trying to address how is this pandemic going to change the world as we know it? And the main narrative of the course is the virus sets the narrative. Really, the virus is something that we really can't control. What we can do is we can try to prevent it, but then we react and we adapt. And societies that are the most versatile and governments that are the most versatile, that plan for the future the best, those are the ones that are going to come out ahead of it. Whereas governments that try to act like they're the ones dominating the narrative and virus be damned, those are the ones that are they're gonna get screwed. And so we've been playing this out all semester, looking at human versatility, looking at other governments and the way that they plan they change their infrastructure, they address inequities, they plan for nationalizing health insurance. And every single time that we look at a good example of really great innovations that come out of pandemics, we say, oh, but in the United States, we're not really exactly doing that quite yet. I mean, individuals are innovating, businesses are innovating, but our government has not thought about the future. And really, that's coming home to roost right now. That in a way, the minute this thing becomes uncontrollable, you see that it's just hard. No matter what your spin is, when you're having rampant infection that you have no immunity for. And so in a way, I just think that really the virus is controlling the narrative right now, and how that plays out in terms of how people. I mean, I know Trump is going to try to make this be like a rise from the dead kind of thing, but how this spins is, spin is great, but ultimately when you have rampant infection like this, you better just try to keep everybody safe. I mean, I think that's really the biggest thing.
So I'm curious for your view on two different ways that things could change potentially. So you point out that we haven't been, as a government, particularly dynamic in our approach to it. We've done far worse than a lot of other countries, and we also know that not everybody takes the virus as seriously. For all of us, it's probably changed over time, but Trump supporters largely seem to be less concerned about doing much about this. Do you think that Trump getting it, and so many other people, the first lady and everyone, could that change either part of that? Either how his followers view the virus, or the approach that our government actually takes to dealing with it? Is this the thing that could change either of those?
Well, let's hope that's the case. But I mean, look at what's happened. Trump said, I'm gonna change my evil ways, and then 5 minutes later, he's taking the joyride around town, infecting Secret Service agents. And so I do think, like many other moments, this is a moment where we should wake up. I really hope that the Trump administration starts paying more attention to science, foregrounding real scientists. Hopefully, this is the moment. We've had 210,000 people die, and so we've had 1 million of those moments. But I certainly hope that this is the case. Now, that being said, the way that the Trump administration is spinning this narrative as kind of a individual sacrifice, and then a kind of he hath arisen kind of story, and it reminds me of a lot of stuff I've seen in my research about people rejecting their own healthcare, people, not just getting guns, but like having 50 guns in their basement, things that were really negatively impacting their health. And so I would say that there's a mistake if people think, oh, because Trump has this, people are all of a sudden going to wake up and start becoming Democrats or supporting public health. I think there's a very real chance that, in a way, the ideologies that resisted wearing masks are just going to become more hardened, that people will become even more ideological. And in some ironic way, this could actually make things worse.
Interesting. So another interesting thing is that when we plan to have you on, we want to talk about the Supreme Court, the effect that Amy Coney Barrett as justice on the Supreme Court could have on things like the future of the ACA. Interestingly, in terms of public health, the fact that so many Republican senators, at least 3 now, have become infected by coronavirus could potentially impact at least the speed at which she gets on the court, if not, the overall impact of whether she does or not. So when you're thinking about her as a potential justice, what do you think her effect would be? Are the concerns that she would, nullify the ACA in one way or another? Do you believe that those are legitimate?
Oh, they're more than legitimate. I mean, they're almost practically factually correct, considering everything that she's written in the past. No, of course, she would just be one of 9 justices, but I think that where do I even start with this? I mean, there was this Texas and California cases that were thought to be too radical and too extreme, even for the GOP 6 months ago. The idea that they would sink the entire Affordable Care Act during a pandemic, and lo and behold, that's the case that's now going to be more than likely passed through the Supreme Court if she gets on there. So to me, it's horrific for a bunch of reasons. We've talked about this before, but taking away people's health care during a pandemic, reversing the gains of states that have expanded Medicaid, right? That's going to lead to dramatic rises in people getting kicked off of insurance rolls. People don't even realize how bad that is, largely impacting lower income, minoritized populations in blue states. Sense a theme there, but the entire country is going to just, the entire country is going to be at the whim, really, of insurance companies who, across the board now, will have free reign to deny care for people with pre-existing conditions. It's much cheaper for them to let you die. It's actually a lot cheaper than it is to cover a pre-existing condition, and that was a protection the ACA gave. And so the fact that we're even having this debate in the middle of this horrific pandemic. To me, it's I would say it's surreal, but unfortunately, it's all too real. And I think that if she gets on the court, I'm pretty certain that's going to happen.
For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/The Damage Report. And you can ring the bell wherever it is so you don't miss anything.